what happens if they do not go to a dialysis appointment? They see, let me pause. Somebody has their mic on. See, mute all. Okay, cool. So a few things can actually happen. I've actually seen one patient that missed the whole week, and he was in really bad shape. See, they'll have shortness of breath, edema, electrolyte disturbance. So as far as shortness of breath, well, I mean, just pretty much everything. So if these patients are not getting their dialysis, all those toxins are backing up in their system because their kidneys are not able to filter out everything, almost nothing, right? So your patients are going to be very sick. They're going to be vomiting. Their body is starting to malfunction and shut down slowly. Also, edema is a big one because the body's not able to filter out well, the kidneys aren't able to filter out the blood, so you're going to have edema as a result. Edema is just a lot of fluid building up in a certain spot. Let's see. Bleeding from AV fistula. So the sites where the needles are inserted or the tubes are inserted to take the blood out of your patient and put the blood back into your patient, if those break, it's pretty bad because they can't clot. Those are just tubes that are attached to the vessels in the body. And the biggest thing to look out for when talking about this is when you're taking a blood pressure. Every time you're taking a blood pressure, and especially if you know your patient is a dialysis patient, you always want to ask the patient where they have their fistula at, because usually it tends to be. See, from I remember it was no, honestly, yeah, it was either right or left, and I think they go off of whether you're right dominant or left dominant. If you're right dominant, they'll put it on the left side. If you're left dominant, they'll put it on the right side because they want the least amount of movement, and aggravation for that tube, so it won't break away or dislodge or anything. So just be real careful with these patients. If you know they have dialysis, then you want to ask them where it is located, so you're not taking a blood pressure on the site, because if you apply all that pressure, you're gonna bust the tube. And it's very, very hard for this patient to stop bleeding because they can't clot right there. Also, look out for any bacteria infections. See patient care, ESRD, patient with complications of dialysis. Obviously, assess ABCs for every patient. That's primary assessment stuff right there. Control the bleeding. If they do bleed out, you're in for a surprise maybe, because I actually had one patient that they had a connection in their subclavian. Yeah, it was a subclavian insertion, and it actually busted, and it was insane. That patient was just bleeding out, and they were freaking out, and they were trying to be cool, and I was freaking out, but I was trying to be cool too. But they actually survived. But it's a lot of blood, and if you're not used to it, it's gonna freak you out a little bit. I don't care who you are for the most part. But remember, always be cool. No matter what, even if you're freaking out, always freak out inside and be cool outside. It'll save you a lot. Kidneys are the most commonly transplanted organs. Well, I think it's in where is it at? Pakistan or one of those Middle Eastern countries where nobody has kidney issues. So what they do over there is they'll actually pay you for your kidneys. They pay you like something like $1,200 or $1,500 like US dollars, like equivalency of US dollars. And so here we actually have a need for more kidneys. But I don't think they pay people for kidneys. So you have to just donate the kidney. But over there, oh, it's Iran. So in Iran, they actually have a program to where they'll pay you for a kidney. It's kind of cool, I think. We should probably have that here. But see, patients spend their lives on special class drugs. Yeah, so if they do have a transplant, it doesn't really matter which kind of transplant. For the most part, there are issues with the body accepting transplants from other people, and it's because the body sometimes will see that new organ in the body as a foreign invader, and it starts to attack that the new organ, and so they do have to be on medication sometimes just to kind of help that. And let's play this video, see what it's about. So new share, where's it at? Where's it at?
There are two types of renal or kidney failure, acute and chronic.
Acute renal failure is the sudden loss of kidney function that develops as a result of an injury or damage to the body in general, or the kidneys in particular.
Acute renal failure is caused by a blockage of urine flow out of the kidneys and into the bladder, exposure to certain drugs and/or toxic substances, or significant loss of blood, or a sudden drop in blood flow to the kidneys. Kidneys that have pre-existing disease or damage are at higher risk for acute renal failure.
Signs and symptoms include confusion, drowsiness, decreased urine output, small breathing, dyspnea, tachypnea, and coma. Acute renal failure is a very serious condition with a mortality rate in excess of 50%. Chronic renal failure develops over a much longer period of time as nephrons lose their ability to function and are replaced by scar tissue. Usually, this takes place over the course of many years.
In the early stages, there may be no symptoms, and progression may be so gradual that symptoms do not occur until kidney function is less than 1/10 of normal. Diabetes and hypertension are the two most common causes and account for approximately 2/3 of the cases of chronic renal failure. The goal of treatment for all renal failure is to identify and treat any reversible causes, as well as preventing excess accumulation of fluids and wastes, while allowing the kidneys to heal and gradually resume their normal function. In some cases, dialysis may be necessary. Dialysis is a method of removing toxic substances from the blood when the kidneys are unable to do so. Some patients may require a renal transplant to implant a healthy kidney into a patient with kidney disease or kidney failure.
All right, that's it for that one. Give me 5 minutes.